Good evening, everyone. Welcome to another discussion program of Renew the African Mindset, otherwise known as RAM. Renew the African Mindset is actually a platform where we share views and experiences. It's actually a platform where we create awareness of topical issues and life issues, really pertinent to us, which are hardly discussed in the open within the African community due to perception of this, stigmatization due to cultural beliefs, traditional values, and at times it's due to ignorance, which we found out, especially when it comes to health related issues. People hardly talk in the open, and unfortunately, they fail to seek prompt intervention. So today we're going to talk about something very, very crucial, something, this is a topic which is very sensitive because it relates to men's well-being. People hardly talk about this in the open, especially men. Maybe it's because of the perception of men being macho. We're going to find out. So today we're going to talk about erectile dysfunction or andropause. Are they the same? We're not sure. We have two urologists here with us this evening to educate us on what erectile dysfunction is. What are the causes? What are the risk factors? What are the symptoms and the available treatments out there? Now, we're also talking about alternative medicine. So we have two traditional uh, practitioners amongst us. And they're going to talk about herbal remedies in as much as we have the medical experts here. So we're going to have diverse perspectives to this discussion and to enable us to understand more. Somebody's going to share their personal experience of erectile dysfunction with us. And so, without further ado, I'm just going to call on the first panelist who is going to start with the basics because we don't want to take it for granted that we all know what erectile dysfunction is all about. So, the first person I'm going to call on is actually a urologist. Um, his name is Professor Chinegwundo. He's a consultant urological surgeon at Bats Health NHS Trust in London and also honorary visiting professor to the School of Health Sciences in the City of London. He's an academic clinician. He has a particular interest in ethnicity and prostate cancer. He published the first paper in the UK demonstrating 2 to 3 fold increased risk of prostate cancer in black men. In November 2016, he was the subject of a BBC News piece on prostate cancer research in the UK and Nigeria. He has a long-standing interest in cancer in general through his 22 years chairmanship of the UK registered patient charity Cancer Black Hair. He has been a government advisor on cancer since 2007. He has co-chaired the Prostate Cancer Advisory Group and is a member of the Bowel Screening Advisory Committee. In 2013, he was awarded an MBE for services to the UK National Health Service and Urology. Clinical interests include prostate cancer diagnostics, having introduced transperineal prostate biopsy to his institution, and prostate brachytherapy for prostate cancer. He has appeared on television with Ricky Gervais, Carl Pilkington in a sketch called An Idiot Abroad. He has actually published series of he has published series of papers and widely published and enjoys international prostate cancer research collaborations. He is very much in demand for his medical legal expertise. He is a trustee of TACL, that is the prostate cancer, and also advisor to Prostate Cancer UK. The reason why I mention prostate cancer is because this is about the third time Professor Frank is appearing on Renewing African Mindset, and he previously educated us on prostate cancer. So, who better to actually talk us through what erectile dysfunction or andropause is all about than no better person than Professor Frank to open up the discussion with us. Now, welcome, Professor Frank. I have some questions here to ask you from the basics here.
Sure.
What exactly is erectile dysfunction, otherwise
So,
known as ED?
yeah, so erectile dysfunction, or abbreviated as ED, is the persistent inability for the man to achieve an erection, that is, the penis hard enough for satisfactory penetration.
Right.
So it's defined by penetration.
Right. Would you say ED, erectile dysfunction, is it the same thing as andropause?
No, they're completely separate things. The andropause is very much a term of controversy, and most urologists don't believe in that term. The andropause is badged as being the equivalent of the menopause in women, and
Right.
the andropause is meant to be to do with the reduction of testosterone that happens as men age, but it's not equivalent to the female menopause. It's not equivalent to in a woman where the hormones suddenly fall off a cliff, so to speak. It's not equivalent to women where that's the end of their reproductive capacity. So many urologists dispute that there is such a thing as an andropause.
Okay.
But if there is a thing as an andropause,
Right.
what you can take it to be is to do with the decline of testosterone that happens in men naturally as they
Right.
age. And if your testosterone level gets low enough, then it can cause problems with erectile dysfunction, as well as muscle weakness, irritability, and poor concentration. So
Okay.
erectile dysfunction can be a component of the so-called andropause.
Okay. So, to anybody just listening, non-medical person, what does testosterone mean?
Testosterone is a chemical that's produced by the testicles,
Right.
and it's the equivalent of estrogen in women, which is produced by the ovaries.
Right.
So this hormone, this chemical testosterone, is
Mm.
responsible for making men men. It's responsible for the hair growth in men. It's responsible for the voice being deep in men. It's responsible for the muscle strength in men. It's responsible for the ability to get an erection.
Right.
It's responsible for fertility.
Right.
So,
So,
yeah.
when you're talking about the low levels, how low can it be? Can can it be how low in order to say that somebody has a low sperm count?
Oh, a sperm count is something different altogether. The sperm count is to do with the number of sperm that the man makes. That's nothing to do with testosterone levels. So
Yeah,
if
because one of the questions that somebody actually asked,
hmm,
or more or less told me to ask, is how low can the testosterone level be?
well, we define a low testosterone as being below 7 nanograms per mil.
Right.
So the normal range is quite variable. The normal range is anywhere from 7 to 27
Okay.
nanograms per mil. And we say if it's below 7, then you are deficient.
Okay, that's the question, and that's the answer. Thank you very much. So, when you say that, um, well, let's talk about it this way: is ED the same thing as being important?
They are used interchangeably. Yes. So when men are talking about being impotent, they're really meaning that they have erectile dysfunction. So you can use the terms interchangeably.
Okay,
So
right.
yes is the answer.
Is it reversible?
Depends on what the cause of it is.
Mm-hmm.
So it may be reversible or it may not be reversible, and you would have to see a specialist to try and determine why you have that problem
Okay,
and see if that problem can be fixed.
okay. What are the causes, the risk factors, and the symptoms?
So the risk factors are for erectile dysfunction are a great many.
Okay,
So cardiovascular disease
right,
is a major one. So people who've had heart attacks, for example, will get to erectile dysfunction. People
mm,
who've got angina,
right,
um, because to get an erection, you need to get blood flow through the penis rapidly.
right,
And if your coronary arteries, the arteries to your heart, are narrowed due to atheroma, due to fat deposits, then the same thing will happen in your penile blood vessels. And so heart disease are likely to get erectile dysfunction. So diabetes again is a very common cause of the erectile problems because the sugar damages the penile smooth muscle as well as blocks the blood flow to the penis.
Right.
There's an association with having high blood pressure,
Mm-hmm.
and also the tablets that you use to treat blood pressure as well impact negatively on your erections. People with renal failure, which is again is common in Black people, will get erectile dysfunction.
Sorry, what's rhinophaenia?
Renal kidney failure,
Kidney
kidney
failure.
failure.
So, because there are some people who are non-medical, so we just need to be very mindful of that. Yeah.
Sure,
Okay.
sure. People with kidney failure
Right.
also will get erectile dysfunction.
Yeah.
People suffering from depression or
Mm-hmm.
various other psychological ailments may also present with erectile dysfunction.
Right.
There's a long list of medications, long list of tablets
Mm-hmm.
that will cause problems with erections. Various operations, uh,
Mm-hmm.
particularly in the pelvis, such as bowel surgery
Right.
or prostate surgery,
Right.
they can also cause erectile difficulties because you damage the nerves during those operations that cause erections.
Good. You
So
know, there was also something I was looking at here: stress from social, cultural, or religious conflicts. What does that mean?
sure. So any there's a relationship between the mind and the penis. So I mentioned depression
Yes.
um, earlier on as being a cause. So any stress, people losing their job or people in some sort of domestic strife or having problems at work, these things can impact on the man's ability to achieve an erection.
Right. Okay, so these are the causes. Sorry, also, what about, you've talked about the risk factors, you've talked about the causes. What about, before we go into the treatment, I want to bring in uh, the GP here to get some idea of the type of patients it would say before they are being referred to people like yourself and Dr. Abolariwa. Let me quickly ask. Here, we want to bring in the GP, and the GP we have to talk to us this afternoon is Dr. Abayomi Ajigini. Dr. Abayomi, before I read your profile, what exactly do you watch out for before you can refer somebody to somebody like maybe Professor Frank or Dr. Abolariwa? What do you look out for?
Thank you, Anne, and thanks for organizing this. Um, as Paul said, um, I just quickly go to into Andropause and ED. They are both different things, and that okay, there is no definitive time that
Mhm.
a man goes into andropause like menopause.
Yeah.
So when I have a patient come to me, most of the time, it is a kind of having a high index of suspicion.
Mm-hmm.
As Bob has mentioned, there are some medical issues that when this patient has them,
Mm-hmm.
you will want to include testing or asking questions
Right.
about relationship, about what is happening in their life,
Right.
which then guides you into possibility of doing a blood test for
Right.
testosterone level.
Right.
Um, so, for example, a patient, according to guidelines, people with diabetes, a long-term diabetes,
Right.
some people are on some medications, on opioids, and some people who have had heart attacks. Actually, before I talk about people that have heart attacks, when people come to you, especially people with prostate issues,
Yes.
one of the questions you need to ask them, also people with diabetes, is about erectile dysfunction. Patients don't volunteer this kind of information, so you have to find a way to ask. If someone comes with depression, then you can just ask, oh, how is relationship at home?
Mm-hmm.
If they come with prostate issue, or so you just pitch it to them. How is relationship at home?
Yeah.
Then they might volunteer. Oh, okay, I have an issue there, and being a man,
Mm-hmm.
I tend to just push it to them. Okay, is there an issue with erectile dysfunction?
Right.
And then they can load down with me, and we can discuss from there.
Yeah.
So with these medical conditions, once we find some inkling that there might be issue with reduced testosterone, then we do a blood test.
Right.
So we do the initial testosterone test, and testosterone has two levels, or should I say, in the morning, testosterone level is high and is adequate, and then it gradually reduces as the day goes by.
Mm-hmm.
So we always ask men to have the test done,
Mm-hmm.
in the morning before before 11 a.m. So between 8 and 11 a.m.
Mm-hmm.
That so we get the value. If, as Paul said, if the value comes in and it's between, let's say, 8 to 12
Yeah.
nanomole per liter, we then ask them to repeat the test, in about 4 weeks' time, and we see what the level is. If it's lower or if it's below 8, we still want to repeat the test.
Yeah.
But when we repeat the test on the second time, we do other hormones in
Yeah.
association with it to actually know whether it's a testicle,
Right.
because the testicle is the primary producer of testosterone.
Yes.
So we now do other hormone tests to make sure that is it the testicle that is the main cause, or something up here that
Yeah.
is actually not working. Because the testicle is controlled by some chemicals, some hormones that come from up here.
Yeah.
So we do those tests, and that gives us the should I say, the armor to refer to Prof or Dr. Bolariwa.
Mm-hmm.
If it's low, then we can say, oh, if it's only the testosterone that is low and these other hormones, what we call luteinizing hormone and all sorts, if they are normal or high, we
Mm-hmm.
can say basically it is the testicle that's got problem.
Mm-hmm.
Or if these other hormones are also low,
Mm-hmm.
then we know the problem is from up above.
Mm-hmm.
And then that also gives us the guidance to be able to refer to Prof
Mm-hmm.
or Dr. Bolaru or any urologist to
Mm-hmm.
say, this gentleman have done the testosterone twice and is consistently low in association with this, and
Yeah.
that also helps them to know the next level, so they don't have to repeat the test, although they will still have to do some other tests on them. So basically, for most people that come to the GP,
Mm-hmm.
if they have some medical issues,
Mm.
it also points towards possibility of deficiency in testosterone. And the deficiency in testosterone is called andropause,
Mm-hmm.
while erectile dysfunction comes up when testosterone level is below certain amount, which is that below 8 or 7, as Prof said. So most people will get erectile dysfunction if their testosterone is below that level.
Mm-hmm.
So that's where uh, you know.
So it's through the blood test. So before I ask further questions, let me just quickly read your profile for the benefit of our audience as well. Dr. Abayomi Ajigini obtained his MBBS from the University of Lagos in Nigeria and subsequently trained as a surgeon in the UK, obtaining the fellowship of the Royal College of Surgeons of Edinburgh after obtaining MBA from the University of Surrey. With a focus on healthcare management, he decided to train as a GP, otherwise known as general practitioner, and obtained the membership of the Royal College of General Practitioners in 2011. He currently works as a freelance GP in Kent while studying for a Master's of Sports Science. Um, He currently heads the medical team of a Christian charitable organization and has organized various outreach programs in conjunction with the Royal Borough of Greenwich Public Health Team, Prostate Cancer UK, Cancer Research UK, British Heart Foundation, and Sickle Cell Society. He's passionate about promoting good health and well-being, especially among the black minority ethnic groups in Southeast London. Um, Dr. Ajikini, otherwise known as Dr. Aji, when you're talking about this test, so usually it's through blood test, how would you know if the ED, otherwise known as erectile dysfunction, is physical and not mental? And if it is mental, what's the next step?
Okay. Majority of the time,
Yes.
yes, it is mental, what we call psychogenic or fear of performance.
Right.
However, if someone is in a relationship that's been for a long time
Right.
and there is mutual affection in the relationship and there
Right.
is no other issues going on,
Right.
you will not want to attribute any erectile dysfunction to a mental issue in
Right.
a loving relationship.
Right.
So you will have to then start looking for a, should I say, a biochemical or medical cause of it.
Right.
Sometimes they are on some medication, sometimes they have added medical issues that predisposes them to having erectile dysfunction. They might have had some surgery that has destroyed the nerves in the pelvic area. And by questioning them, you are able to know that, okay, these issues is more of the mind or there is a medical background to it.
Right.
And just like in menopause, where a woman might have issues of emotional distress, emotional issue, hot flushes, and initially you might be thinking, okay, is they psychological? But when you then go ahead and do the hormonal assay,
Right.
you will be able to say, okay, there is a deficiency of hormone here. If there is a deficiency of testosterone below 8,
Right.
it is likely to be the cause of the erectile dysfunction. Obviously, if they have diabetes, diabetes is one of the causes of erectile dysfunction. If they are what we call arteriopath or they suffer with cardiovascular issues, they've had heart attack before, they suffer with high blood pressure,
Right.
those conditions, they also predispose people to developing erectile dysfunction.
Right.
So you look at the totality of the person, what's happening with his relationship, and what his medical history is about, and that will give you the guidance on what to do, on how to investigate or manage this person further.
Okay. Quickly, do men also get hot flushes like women when they're going through menopause?
Yes, they do. Because when you have andropause, I know Prof said there is no a lot. Andropause is a kind of a term of contention in that in men it can happen to anybody. When you pass the age of 40, the testosterone levels start going down 1% by every year, every 10 years. By the time you are like, so you keep getting reduced testosterone. So the effects, one of the effects that it causes is hot flushes. It causes loss of bone mass, reduce cognition. It can actually be a cause of depression. So that some people, when we've been treating them for a while with antidepressants and we're not getting anywhere, when you actually then say, okay, how is relationship at home? How are you? And then you start talking about things not actually happening, loss of interest in sexual function and things like that. Then
Yeah.
you might say, oh, let me actually check your testosterone. And then you see, oh, this is low. It's
Yeah.
not just my medication because some of the antidepressants we use can also be responsible for erectile dysfunction.
Right.
But if you do the blood test and it shows that, oh, testosterone is low, then you do know that, okay, this is biochemical, not just mental issues. So
Yes.
yes, men do get injuries, they get wastage in their muscles, they get bone pain, bone problems, cognition problems. A loving gentleman then all of a sudden becomes moody at home. The
Mm-hmm.
wife can't understand him anymore.
Mm-hmm.
It could be, andropause.
Thank you so much for that. We'll hold it right there. Let me quickly go back to Professor Frank. Professor Frank, there's something also called penile curvature or lump or bump. Is this a symptom of ED or is it a separate issue?
No, that's a separate issue. That's a separate issue. I think you're referring to what we call Peyronie's
Right,
disease. Peyronie's disease is a condition where scar tissue forms within the penis for reasons unknown.
right.
That causes the penis to bend in one direction when the penis is erect. It
Yeah.
can be associated with erectile dysfunction, but not necessarily.
Okay. Now, what are the treatments available?
For erectile dysfunction
Correct.
or,
Yeah.
or
For
okay.
erectile dysfunction. Yeah.
So erectile dysfunction. So there's a variety of treatments.
Right.
First of all, you try and find something in the medical history that you can change or you can improve. So, for
Right.
example, if you're on if you've got hypertension, that
Mm-hmm.
is high blood pressure,
Mm-hmm.
some tablets are more likely to cause erectile dysfunction than others. So you may
Right.
be able to switch tablets.
Right.
If your diabetes is poorly controlled, then try and get control of the diabetes.
Right.
If you've got peripheral vascular disease, then try and do more walking to increase the blood going through the vessels. So there may be something medical
Mm-hmm.
that you can change. If you find the testosterone is low, which is
Mm-hmm.
actually a pretty small minority of men,
Right.
is the erectile dysfunction due to low testosterone.
Yes.
But if you do find that, then you can give them testosterone supplementation, either by injections or by skin patches.
Right.
Um, but for most men, we find, and also very importantly, if you're smoking, stop smoking. That's a commonest reason for men under 40 to have erectile dysfunction is smoking.
Smoking. Okay.
So, if we don't find any medical problem that can be altered, um, and the hormonal levels are normal, then we start looking at tablets such as Viagra or
Right.
Cialis
Yes.
uh, to deal with erectile dysfunction. Or we've got um, a pellet called Muse, MUSC, which
Right.
is a drug that you can insert as a pellet into the end of the penis, in the end of the urethra, which dissolves in the urine there and can give you an erection. There's a cream called Vitaros that again it contains what we call prostaglandin, which is a chemical. You can squirt this cream into the urethra, and that can cause an erection. Excuse me. There's injections. You can inject prostaglandin into the penis.
Mm-hmm.
You know, when you want to get your penis hard, that can also be very helpful. There's also what we call a vacuum pump, which is a
Right.
mechanical device that you put the penis into, and then you create a vacuum by pumping the air out of the cylinder around the penis, and then the penis becomes hard. You remove the cylinder, and then you can have sex.
But for
And
how long is
also,
it though? For how long? Because I remember during the time we had a discussion on prostate cancer and somebody actually mentioned it. But for how long is the when you use the pump, how long is the hardness?
well, the hardness is as long as you want, because what you do is there's a rubber ring that you put down onto the penis, right down to the bottom of the penis, and it'll keep the blood in there for as long as you want it to be there.
Right.
So it could be, if you want it to be for 10 minutes, fine. If you want it to be for 20 minutes, also fine. And then when you finish having sex, you remove the rubber ring and the penis goes down.
Right.
And if all these methods fail, it's possible to have a penile implant. This is an operation where you can plant these silicon cylinders hidden inside the penis, which you can activate to make the penis hard, or you can deflate to make the penis soft. So
Right.
the message I tell men is that there's always something that can be done.
Okay.
Depends on how far they want to push it. And then we mustn't forget the psychological aspects. So there may be some physical problem causing
Yeah.
erectile dysfunction, but there's almost always a psychological aspect to it as well, which has to be addressed. And so there are psychosexual therapists that can be very useful in this regard.
So when you mentioned that psychological effect or psychological problem, is that the man feeling having some sort of feeling that he's not a man, or
It
that
can
he
be
can't perform or something?
sure. It can be very complex indeed, or it can be relatively straightforward. So I'll give you an example.
Yeah.
So I will see a man who will come to me and say, I have a problem. I cannot get erections with my wife,
Yes.
but with my mistress I can.
Okay.
So there's no physical problem.
Yeah.
It's a mental problem. It's a guilt problem, or he doesn't find his wife so attractive anymore. So
Right.
it's so at times you can say very clearly this
Yeah.
is a psychological problem.
So
But other times it's more complex.
okay. So at times some patients could come to you directly instead of going straight to Dr. Aji. Is that what you're trying to say?
Or they may go to the GP and then come to me. But yes, patients can come to a urologist
Direct?
directly.
Okay, all right then. Let's hold it there. I'd like to bring in the female urologist here. Dr. Abimbola Ayodeji Abolariwa is a lecturer in the Department of Surgery, College of Medicine in Lagos State, Nigeria, and honorary consultant urologist with the Lagos State University Teaching Hospital. She had her residency training in surgery and urology at the Lagos State University Teaching Hospital in Lagos, qualified as a urologic surgeon in 2013, making her the first female urologist in Nigeria. She's a fellow of the West African College of Surgeons. She practices as a general urologist with broad-based clinical and surgical experience in most urologic cases. However, she has special interest in andrology and pediatric urology. A multiple awardee, she's passionate about her patients' welfare and also loves to teach, train, and mentor her medical students and resident doctors. Welcome, Dr. Abimbola Bolariwa.
Good evening.
Good evening, Dr. Polariwa. Welcome again to Renewing African Mindset. You were with us on prostate cancer when we discussed the topic. Now, we've heard some of these treatments, but there have been reservations with regards to a particular treatment called something therapy, testosterone therapy. Why is there a great concern about it? Some people say it has a link to prostate cancer. How true is that?
Actually, testosterone treatment has some issues, just like the way hormonal treatment has some issues in postmenopausal women.
Right.
There is a risk of them developing cardiac disease, and strokes, and then also the risk of progression of prostate cancer if they have prostate cancer or they are at risk of prostate cancer.
Right.
Majority of the patients that have erectile dysfunction are in the older age group who are already at risk for prostate cancer. So before you commence on testosterone therapy, you want to find out what is their status concerning the prostate with respect to cancer.
Right.
It's like it's like a thing of weighing the benefits and the risks.
Right.
So you don't just want to give testosterone therapy to most men like that. You need to find out their risk for prostate cancer. You need to find out their cardiovascular risk, because it could actually worsen it for them to have cardiovascular accidents like maybe strokes or heart attacks, which is similar to hormonal replacement in women.
Okay. So when is surgery necessary for ED?
Surgery is one of the last options, and particularly when all other treatment modalities do not work. I'll give you an example. Erectile dysfunction is quite common with the hemoglobin patients in Nigeria. We have a lot of sickle cell disease patients in Nigeria.
Yeah.
And one of the commonest type of crisis they have is what we call priapism. That's an, persistent penile erection that is not associated with sexual intercourse. In fact, very painful. What happens is that the blood in the penis does not drain out, so they have persistent erection. It's like a type of crisis.
Right.
And when that happens, the penis dies. So they are not able to attain erection eventually.
Right.
Regardless of what you use. So in such a case, you will want to do a penile prosthetic surgery. That's replacing the penile tissue with
Right.
these silicone cylinders within the penis. And
Right.
it can be activated to create an erection and deflate it, just like what Prof said earlier on. In
Mhm.
such a case, their treatment is kind of like refractory, it doesn't work. So you want to offer them surgery. And there are lots of patients that have maybe causes that don't work, but it's one of the last considerations. You try so many other options, psychotherapy, drug therapy, and so many other things before you get to the point of surgery.
Right. It's so interesting. You being the first female urologist in Nigeria, how open are men when it comes to talking about ED? I mean, what reaction do you get from men? And when you say to them, well, I've got to check you out and things like that, and they know that you're not just a family physician, you are actually dealing with their genitalia, what's the kind of reception you get?
Actually, you will eventually get to that point. A patient may come in with a kidney tumor, but depending on how you relate with him, it's like a relationship of trust. Then he will come out and confess to you that is your specialty one of those that handle they have different terms for it. They'll tell you power failure and some other things. And you say, yes, okay. Can I tell you about mine? So it's some few patients are referred to you for that purpose.
Yeah.
Some come to you for that purpose, but there are some that it eventually comes out. And a lot of times, by the time we start talking, they really don't have erectile dysfunction. I think their problem is the expectation they have about sexual intercourse. And that is where the psychological pressure comes in. It may
Right.
not necessarily be about loss of job or maybe loss of income, or, it may actually be the expectation. And most times I notice that it has to do with a change of partner. Their steady state partner who understands their sexual tempo is different from who is putting them under pressure to perform better. So most times I try to paint a realistic picture that, look, this is not the way it is. You are okay. For your age, you are okay. I had a 60-year-old man that was complaining that he couldn't go on 4 rounds. And I was like, what is rounds? You should talk about the quality of sexual intercourse now and not the number.
That's
you
right.
know. And it was later I found out that he just had a younger wife, so he was trying to outdo himself, and he was already abusing tadalafil. That's Cialis, one of those drugs that Prof talks about. So I had to disabuse his mind, and he finally accepted. And he came back later, 2 months later, and told me that he was fine. That the woman is happy. She even felt under pressure because of his demands. So
Right.
some of these expectations actually make patients feel they have erectile dysfunction, when technically and biologically they really don't have any problems. So it's more like apart from the fact that it's a medical diagnosis, or it's actually a condition that may point you to a more sinister medical problem, like maybe cardiac risk factors.
Right.
It's also a social issue, and you need a lot of patience and time to actually get the patients to come up and tell you really what the problem is.
That was actually going to be my next question, but you've answered. You see, Africa is a place where some people prefer to use herbal remedies for all ailments. So when patients now prefer to use herbal remedies as opposed to modern medicine, I mean, how do you deal with that?
Well, I don't want to claim that I know everything. Some will tell me that they use some herbal medicines and it works, and I was like, fine. But the only thing I have with herbal remedies is that the dosages and what are the active ingredients in those herbal medications. That's where my problem is.
Yeah.
We have a particular substance that most patients are coming with priapism, and that's that persistent penile erection that is painful. I mean, a man has an erection for 3 days and he's been suffering in pain. And I think when he gets to the point that he can't handle it any longer, he comes into the hospital. A man shouldn't have that for more than 4 to 6 hours.
Yeah.
And then somebody manages it for 3 days. And when he comes, he'll tell you that he used aphrodisiacs because he wanted a better sexual performance. And there's a particular brand that they keep bringing out. It keeps causing priapism. We've tried to push that they should stop the production of that thing. So you see, it works, it gives them better sexual performance, but it also causes persistence of that erection. So my problem with traditional medication is dosage and what are the active ingredients. I know what tadalafil contains. I know we have the 5 milligram, the 10 milligram, and the 20 milligram tablets. So I can give you dose adjustments. But with herbal, we don't know what is there. It's based on personal testimony and word of mouth. But I will not deny that some of those herbal medications work, because most of the pharmacological agents are actually from plants and from the environment. But the problem is dosage.
Okay.
What is the active ingredient? Is it safe? Is it good for other drug combinations that my patient is taking? Those are the considerations that bother me as a clinician.
Okay. Is ED hereditary?
No, I don't think so, except we could have some genetically some genetic diseases,
Mhm.
maybe patients that are born with maybe testicular feminizing syndrome.
Mhm.
There are some conditions that they are born with that actually does not, or maybe what do we call it? Um, Maybe some low hormone levels.
Mhm.
Like I said, testicular feminizing syndrome. There are some diseases that they may be born with that actually does not permit them to have what we call a androgenization. They have low testosterone, so they don't develop fully as males. They
Mhm.
don't develop hair, their voice is feminine and all.
Mhm.
So we have, some patients like that. So truly, yes, they may be born with it. It's a genetic defect, but
Mhm.
it's not too common, but we have them.
Okay. Do you want to add something to that, Professor Frank? Is ED hereditary?
No, it isn't. It isn't hereditary. No, I wouldn't add,
Okay.
add anything to what my colleague has said. I would like to say about the herbal products. Yes, sure. There are herbal products
Mhm.
that work.
Yeah.
The difficulty we have with them is whether they've been subjected to proper trials,
Mm.
so you know what the dosages are, so it's reproducible. But
Okay.
undoubtedly, there are herbal products uh,
Okay.
that work.
Yeah. Well, we have two herbal practitioners here, and they're going to vigorously, you know, support their statements with regards to how their products work and that it's good for majority of ailments that we're always talking about. I want to bring in Dr. Toyin Adenaike. She's a family GP in the UK. She's been a family GP in the UK for over 2 decades. Recently relocated to Nigeria, and she's the medical director and lead clinician at New York Medical Center. Um, Dr. Adenaike, I just want to ask you a question. As a family doctor, now based in Nigeria, do you find it easy to talk to men with regards to ED?
Good evening, and thank you very much for having me again on the panel. Um, um, I personally find it easy, but I recognize very quickly that a lot of men don't find it easy to talk to other women, at least to female doctors about it. That was not my experience in the UK. I think in the UK, there's a lot of health education
Yeah.
that goes on around. People are used to going to their GPs with all of their problems. So
Yes.
men don't tend to be shy. But what I find in Nigeria are two things. Men don't tend to seek help early enough,
Right.
and they also come with what we call passport symptom. And I think one of my GP colleague has already mentioned that. So they come in with other ailments.
Right.
So one has to have a very high level of awareness and to
Right.
read their body language and
Mhm.
recognize that there may be more to than the passport symptom that they have come with. And I find that I need to do that a lot with the men in Nigeria.
Mhm.
So fortunately in the UK, we're trained to use every opportunity that you have contact with a doctor to do health promotion. So
Mhm.
what I do is I put the ED under the cap of health promotion. So the same way, it doesn't matter what a woman comes with, I will talk to them about pap smear, breast screening, and so on. Whatever a man comes with, I would always do a bit of health promotion. So I would actually tell them that, as your GP, I can't let you go without asking you certain things. And I almost always will try and, put that in there.
Right.
But most of the time, they won't come out to say they have ED. So one has to try and get it out of them and recognize when they come with passport symptoms so that you can actually dig deeper. The other thing I do is I use their spouse, because a lot of the time it's the wives that will come in. In fact, I can tell you loads of stories. Wife coming in with infertility, and then
Mhm.
we find out that they're not actually having sex because the man can't. So a lot of the times, if the wife comes in with a condition, I try and encourage them to come as a couple so that I can use that opportunity to talk to the men. And I'm sure you've noticed today, women were generally very open about our health.
Yes.
When we had the talk on menopause, I think we had double the number of
Oh,
participants
yes, of
that we
course.
have today. So women were comfortable talking about our health. We share it with other women. We share,
Mhm.
but men, um, it's just not in their nature, particularly African men. There's just something about being masculine, being manly, being the king of the castle, being the head of the family, and so on and so forth. The other final point, so that I don't take too much time, is I find that when I do find men with ED in Nigeria,
Yeah.
I find lots of other illnesses, and I'm not going to go over what Prof has already said. So, a lot of them have other medical problems, particularly diabetes. A lot of diabetes is going unrecognized and undiagnosed in Nigeria. Depression is another good one. You know,
Yeah.
we've had talk on mental health and our perspective as Africans too. They will never come in and say, I am depressed. Again, they will come with what we call a passport symptom. And then when you dig deep, you find out that ED is part of all of that. I have mentioned infertility already. Thyroid problems. I'm finding thyroid problems in lots of men in Nigeria. In fact, I've seen as many men with thyroid problem as I have seen with women. Whereas in the UK, it's commoner in the women.
Right.
So when I'm in Nigeria, I have to adapt my practice to Nigeria. Obviously, the background and the education in the UK goes a long way to help towards all of that. Thank you.
So the expression is so apt when they say, when you change your location, you change your orientation.
Absolutely.
Okay, fantastic. Thank you so much for that. Now I'm going to bring in Mr. Evan Russell to briefly share with us. I would ask about two, three questions with regards to erectile dysfunction. Um, Mr. Russell um, is from the Afro-Caribbean community, and at the same time he's been on RAM program before to share his journey of prostate cancer with us. Mr. Russell, welcome again to RAM, Renewing the African Mindset.
Welcome to you all. I'm really enjoying this discussion because I've been hearing some things which I did know about, but it's clearer now to me.
Okay, let me ask you the question, Mr. Russell. When did you realize something was not quite right as it used to be?
After the actual radiotherapy treatment which I received, that's when I realized that things were drastically different.
That was for prostate cancer, yes?
Yes, for prostate
Okay.
cancer.
Okay.
Exactly.
So you realized it, or it was Mrs. Russell who told you?
No, it wasn't Mrs. Russell at all. I realized myself
Right.
that it was just not right.
So were you getting tired? What was it? Just give us an idea how you were feeling.
Well, there was nothing there. It's as if you've been after the. I don't forget I got an extensive treatment in radiotherapy,
Right.
and that was something like 7 weeks of radiotherapy
Right.
every day, a dose.
Right.
So it was like 37 single doses of radiotherapy.
Okay. So how did you feel as a man?
I felt really lost in a way. I was happy, I'll tell you, I was happy to be alive. And that's what I focused on. That's what saved me, really. Because in that respect, because I was worried for my wife more than for myself. And it wasn't sort of, my pleasuring whatever, because I'm of an age where, we weren't sort of expecting any young ones, any children to be produced. But sex, say quite clearly, is something I've enjoyed all
Yeah.
my life. So that was important for me to maintain this also with my partner.
Okay. So when you said you were worried for Mrs. Russell, were you worried that she would probably leave the marriage, or because I think that's the psychological aspect that Professor Frank was talking about.
Yeah, that's a psychological. Well, I did sort of weigh that up, but I didn't think that that would have been an option as such. But it was just, I thought to myself, well, this is going to take maybe, I wonder how long it will take before I get back to some kind of normal.
Right.
Because what was happening was and nobody actually told me before the operation, not say operation, but before the treatment,
Right.
the radiotherapy treatment, that this particular situation would arise. I was actually advised by my consultant doctor at the time
Yes.
to have the brachytherapy
Right.
as opposed to the radiotherapy.
Right.
But I wasn't happy with the brachytherapy because of the side effects. I'd heard certain things about the brachytherapy
Right.
which I wasn't happy about.
Right.
But maybe that would have been something which would have helped my sexuality better after the treatment.
Right.
I don't know, but because everybody reacts differently when this type of thing happens.
Right. But at the end of the day, I mean, you mentioned to us that the first thing that came to your mind was that your life first, as long as your life is preserved. And even when you came on the program to do with prostate cancer, one
Yes,
could tell that Mrs. Russell was actually very supportive, and that was very
yes,
important for you.
absolutely. She still is actually, because the fact is there's certain, even after such a long time, I mean, I've been now, the radiotherapy was like 5 years ago.
Right.
I have actually another, well, let's say a follow-up appointment really soon, next week actually.
Right.
And yeah, so I'm constantly being monitored
Hmm.
every 6 months,
Right.
and I am doing very well. Thank you very much. Touching wood at the same time, and God, thank God for that.
Mm.
But there's still issues
Yeah.
around the libido.
Right.
Look, after 5 years, and
Right.
I am only happy. I can tell you that now, that I didn't have a total operation,
Yeah.
because those people, I find, and I've spoken to several people from the support group which I belong to from the hospital, with Guy's Hospital,
Right.
Guy's St. Thomas's and King's
Yeah.
partners, and they they've had really struggling times. They're struggling with incontinence, etc.,
Hmm.
which, thank heavens, I don't have.
Which is
That
good.
is something completely different, I
Yeah.
know,
Yeah.
but maybe it's all tied in. But what I do know, and it was interesting to hear the professor speak earlier
Mm.
about cardiovascular illnesses, because I am one of those people he was talking about, because I actually had a pacemaker fitted 1 year before the prostate cancer treatment.
Right.
And so I was suffering from heart failure, if you like. No diabetes, thank heavens, but high blood pressure is also one of my problems.
Yeah.
Yeah, so maybe that also contributed to a lower testosterone. Obviously, we know that testosterone deficiency was also tied in, because I had, along with the hormone, with the radiotherapy,
Yeah.
there is also hormone treatment,
Hmm.
which I had for 3 years. 3 years. That was, not, that was one like climbing up a hill, It was really, I can tell you
Yeah.
personally, I find the hormone treatment one of the most invasive treatments,
Hmm.
apart from the radiotherapy. The thing with the radiotherapy is, what we didn't know, what I didn't know at the time, was
Hmm.
that also the cells down there, it would be also compromised. And
Right.
that's what's happened. And actually, when I spoke to the specialist nurses or to the clinicians, the surgeons who've done type of operation and stuff, they say, well, you have to wait, you have to be patient, because it could take anything up to 2 to 3 years for normality, some kind of normality to return. So
Yeah.
that's the information which the patient should really know, should hear,
Yeah.
even before they make that decision
Right.
which particular treatment they're going to choose. But I
Right.
didn't have that.
Right. Okay. Thank you so much for that, Mr. Russell. Thank you so much for sharing with us.
Not at
Because
all.
even though I tried as much as possible to encourage some of our African brothers to join us, even if they were going to wear some sort of balaclava to cover their
Ah,
faces, but
please.
they were not going to do that. I'm
Not
sure
at
after this program, they're going to call me later on and we're going to have a discussion. Well, from what you said, I have a note here from Professor Frank. He said definitely the hormone treatment to shrink the prostate before radiation starts will
Yes.
abolish the erection ability.
Yes.
So I suppose
There
that's
you
a
go.
given anyway. Yeah, that's a given. Thank you so much for sharing with us. So I
Not
want
at
to
all.
quickly bring in two traditional herbal yeah, they're well. We would normally say herbalist. So today they're going to educate us. They are maybe it's due to ignorance because the first thing you hear when somebody says a traditional practitioner or herbal practitioner, we start thinking of all sorts, something archaic. We start using some sort of derogatory words like voodoo. But I'm thinking if we're using Chinese herbs, what's wrong with African herbs? So to kick off this particular segment is Prince Dr. Ayeni. He is the president, founder, and the chief executive officer of Yemkem Group of Companies. He is currently the president of the Herbal Medicine Society of Nigeria. Yemkem is a company into the practice of indigenous herbal medicine and a household name. He was previously interviewed by the BBC on the practice of herbal medicine and also by CNN. He is the first herbal medicine practitioner to capsulate and establish a dosage system for herbal medicine. He is pioneer and pathfinder in the herbal medicine world, and he has been in practice for almost 40 years. So some of the drugs is manufactured and produced. He claims that some of them actually do treat erectile dysfunction. So we're going to find out more from him. Prince Dr. Akintude Ayeni has produced well over 40 herbal medicines and is currently developing a herbal remedy to fight against COVID-19. Welcome, Dr. Ayeni. Welcome to Renewed
Yeah,
African Mindset discussion program.
thank you very much for bringing me on board.
Okay, now let me ask you the first question. How do you educate people like me who attribute alternative medicine to being a cake? When we hear somebody dealing, in herbs, the first thing that comes to mind is that, oh my goodness, that person is a voodoo man. How do you educate people like us?
Well, thank you very much. The perspective of Nigerians about herbal medicine some years ago, I think, has changed.
Right. Oh dear, we've lost him again. Okay. Whilst he's still trying to get the network right, I'm going to bring in the other traditional practitioner. Quincy Sumbo Ayodele, popularly known as Dr. Quincy, is a Nigerian herbal medicine practitioner, entrepreneur, herbal slimming and skin care expert, and the chief executive officer of Quincy Herbals. Dr. Quincy is the founder of the Herbal Slimmers and Weight Loss Association of Nigeria and pioneer secretary general of the National Association of Nigerian Medicine Practitioners. She studied natural medicine from the Nigerian College of Natural Medicine, which is a subsidiary of Federal Ministry of Science and Technology, Lagos. She studied naturopathy in the United States and attended several seminars on the practice of traditional medicine in China. Dr. Quincy is a World Health Organization expert committee member on the development of African traditional medicine and practices. She's a very strong advocate for the integration of African traditional medicine into the healthcare system. Welcome, Dr. Quincy.
Yeah.
Okay.
Hi, how are you
Welcome again.
doing?
Yes, we're fine here. You were with us when we
Okay.
talked about menopause. Now, the first
Yeah.
question I'm going to ask you, you could
Mm-hmm.
vouch for the herbal remedies for ladies. People would ask you, you're a woman. How can you vouch for herbal remedies for men?
I can vouch for both for women and for men. But for the one of for men, I will speak as a traditional health practitioner,
Yeah.
and I will also talk from my own personal experience.
Okay.
And I want everybody to get something straight about dosage. They always talk about herbal medicine. Herbal medicine has gone beyond that. You have things like Panama's ginseng. It has dosage. Yuhimbe is a herb.
Right.
It has dosage. Apple cider vinegar is a herb. It has dosage. Fennel is a herb, and
Yeah.
so on and so forth. So, because I'm a member, I'm a committee member on on development of African traditional medicine, practice practitioners and products with WHO, we have been able to actually sort that one out. So it's only the evidence-based herbs that we work on. So all the other ones, well, if you want your herbs to be recognized, you have to take it for standardization, especially also in Nigeria.
Yeah.
So in Nigeria, I'll talk about the ones that have been supported with research.
Mm-hmm.
I'm in support of what our female urologist said, that there are some local herbs that they cause persistent priapism.
Yeah.
That means those patients do not patronize licensed traditional health practitioner. I am a naturopath. I practice here and I practice in the United States, and I practice with evidence-based herbs. Now, that's as a traditional health practitioner. There are herbs that actually can sort out ED or andropause, as they call it. I'll talk from my own personal experience. Let me just explain the mechanism at which we do our own practice. I know that testosterone has a lot to do with ED. You understand? And then we have to now rule that one out. And if there is already ED,
Right.
we want it to perform without necessarily using the testosterone. There are herbs you can use to dilate the blood vessels. There are herbs that you can use as a natural Viagra, which is called the Panas ginseng, the red ginseng, which can actually increase blood flow into the genital area. You understand? There are
Yes.
herbs like fennel. There is valerian root, because you heard from our professors that most of them have anxiety. They suffer from a lot of depression. Oh, valerian root can actually take care of that. So we have to examine the patient and know which area we can come in. We have to be careful. We will not supply testosterone to the patient, because if you do that, the patient can run into prostate cancer, like our fellow just said.
Mm-hmm.
Now let me talk from my own personal experience.
Right.
Well, it's personal, but I'm ready to share it so that other people can learn that so every disease, there's a cure in nature, and nature works. And it works effectively too, but you have to patronize a recognized and licensed practitioner. I'm against all these local branchashi, all these other things that they do. Of course, they work, but if they subject them for testing and standardization, they
Right.
can also be with international recognition. But if it's not subjected to any test, I'm against it that Nigerians should patronize them. But they work, but it has a lot of side effects. Okay, my husband ran into prostate cancer at some point. I'm like, what? As a traditional health practitioner, the PSA was 13 and it was aggressive at home and abroad. We went to the US, it was 13. They said, okay, they had to do surgery and stuff, and so on and so forth. Can we still have like 3 months of grace? They said, yes. So we came back home. And what did I do? Because I may not have to repeat it again. Number one, my husband was obese. So I crashed down the weight. You understand?
Yeah.
I fasted him with green blended vegetables to lose his weight. And I changed his diet. I removed all sorts of sugars, all sorts of carbohydrates from his diet. And of course, I engaged him in a lot of exercises. Of course, I gave him some liver detoxifying herbs. By the time we now went back to the US, within 3 months, the PSA has gone down to 0.1.
Right.
So they asked me, what do they do? I said, since you said you find something there, and they insisted they must operate, but I insisted, okay, do robotic operation, whatever. So they did, when they got there, they practically didn't find anything, but they did it. But we now went into this ED after the operation, you understand,
Right.
after the radiation, and after the hormone therapy.
Yeah.
But what I did after all that, of course, he lost his libido. But I know that he has to gain that libido back
Yeah.
without pumping him with testosterone.
Yes.
So what I did was I placed him on, first and foremost, I eliminated the fact that he should have high blood pressure, because red ginseng was what I used. That's the Panas ginseng. And if you have high blood pressure, we don't allow high blood pressure to go on any form of ginseng. So
Right.
I made sure that the blood pressure was, within normal. So I applied the red ginseng. You understand? Of course, I added some. It's about management. Yohimbe, all these are herbs. I place them on valerian roots
Yeah.
so that you can be able to calm down and then accept the fact that this is not going to be forever. Of course, you are sick, then you have to get better.
Yeah.
Then I still kept on maintaining his diet,
Right.
because I don't want him now to run into high blood pressure or diabetes or stuff like that.
Right.
Thank God he cooperated with me, and within 6 months he got his libido back. We went back to test for testosterone is zero, as at within 6 months ago. Do you understand? And he has his libido back, and everything I did for him was herbal medicines, of course, with management, because I know what to give. So those people who are saying no dosage, I mean, let us read up. There is dosage in herbal medicine. There is dosage in the evidence backed up herbal medicine. I mean, it has gone past the stage of where somebody will come and say, no dosage. Don't let us be saying that again.
Okay.
There's development of African traditional medicine now. And people like us, I'm not going to keep quiet and listen to people saying my herbs have no dosage. The ones that don't have dosage are the ones that the local practitioners are still using that has not been standardized. And if you are an African and you are patronizing them, you're on your own.
Yeah.
But one thing I want everybody to know is that whether the world likes it or not, we have 80% of Africans patronize traditional health practitioners. It doesn't matter whether they are giving them the truth or whether they are giving them what they are giving them is a lie. They patronize us on a daily basis, in fact, massively. So that was the reason why WHO called some of us to come and see how to solve that problem. So
Yeah.
we just have to keep licensing practitioners so that we can keep all these quacks away from our midst. There are herbs with dosage, plenty of it. You
Yeah.
just have to know which one you want to practice with.
Yeah.
So for people with ED,
Yeah.
they can manage you without actually pumping you with testosterone.
Yeah.
We can dilate you, we
Yeah.
can,
Yeah.
as I said before, we can give you herbs that can pump blood into the genital area without causing persistent priapism
Yeah.
at a certain, dosage. It's all about management. That is the good thing about traditional health practice.
Wow.
We manage our patients, both of whatever the symptoms is, and the patient is himself. We
Thank
just don't go into the situation without considering other factors. We are holistic in nature. Let me just put it that way. We
you.
put so many things into consideration, and then when we now reach a limit
Yeah.
that we know that this herbal medicine cannot
Mm.
go further than this, we refer.
Yeah.
to our other colleagues, practitioner,
Yeah.
and we collaborate. We
Okay.
work together for the benefit of everybody.
Thank you so much
Thank you.
for such an insightful contribution, Dr. Quincy. It's and then for sharing with us, because a lot of African women will never share such sensitive information about their partner. I'm sure some people are hearing this, and maybe they'll go home and tell their partners that, look, there is nothing wrong, in whatever you are going through. Herbal treatment is out there, and then of course we still have the likes of Dr. Ajikini, Dr. Adenaike, Prof. there to go to for consultation. But one question I just want to ask you is that how open are the men with regards to consultation, Dr. Quincy?
Yes,
How open?
from my own experience, men are open with my patients that are men are
Right.
open with me. They
Really?
just come and say, do you have anything for libido? I'm like, okay. How then get into conversation with them and then discover sometimes some of them might be having enlarged prostate already.
Mm-hmm.
Some might be obese already.
Right.
So it depends on what they are having. We look after all that, and then I ask them to invite to let me see their partners. When they start regaining their libido back, I
Yeah.
want to talk to their partners.
Mm-hmm.
Because I'm not allowed to talk about my patients, that's why I spoke about my husband. I've
Okay.
had instances where um, I don't know whether to say this. Some patients came as
As long as
on
you're not
their
mentioning
own.
the names, yeah.
Okay,
Yeah.
as a male patient, came in on their own,
Yes.
suffering from having that ED, and
Yes.
then we were able to at Quincy, we were able to manage them of the ED,
Yes.
and then we later discovered that he started having a strange woman. A strange woman was sleeping with him to the extent that the wife had to come and ask me, "What did you do to my husband?" I'm like, "I'm not allowed to talk about your husband to you. Ask him." That I said, but why? He said, because at home, the husband has not been able to do anything with her for the past 3 years.
Mm-hmm.
But now she has heard that he's living with a girl for the past 1 year in a remote area. That if he's not doing something with that girl, why is he living with the girl? But and I know that the man has regained his libido back, but I didn't say anything. I said I will advise that you go home and sort it out.
Mm.
But with my patient, I counseled him
Mm-hmm.
that now that this thing has come back to normal,
Mm.
then you want to try it with your partner at home. But
Mm-hmm.
there are some things I want to talk to women about.
Mm.
I know about men.
Mm.
You don't let them to be ashamed
Mm.
of that condition. You
Mm-hmm.
must be in a position to help them out of that condition.
Yeah.
If your spouse suddenly cannot perform as
Mm-hmm.
he used to perform before,
Mm-hmm.
as the wife, you are supposed to encourage. You are the one that should even go out looking for solution so
Yeah.
that you are in need together.
Yes.
If you are in need together, then your husband will everything will come back to normal.
Mm-hmm.
The therapy the traditional health practitioner is giving will work fast, and then you'll be happy back together. So women should
It's,
not see it as a, even if the men are seeing it as problem,
yeah.
you know it's a problem, but don't encourage them that, oh my God, it's finished. Oh, I've also had instances where
Yeah.
a wife packed out of the husband's home because of ED. She
Mm.
just left him, which I don't. That's
Mm.
not acceptable. You are his wife, for Christ's sake. You have children for him,
Mm.
and then he is now sick. You
Mm.
now left the house. That's not acceptable. We are supposed to be in it together, looking
Yeah.
for solution. If
Mm-hmm.
solution comes, glory be to God. If
Yeah.
solution doesn't come, you are together.
Yeah.
After all, you married for better, for worse.
Yeah.
So why would you now abandon him because he's sick?
So
I
what
mean,
you're
if
more or less saying is that women should be very supportive of their partners,
yes,
which is very
yes,
important.
yes,
Thank you so much for
yes.
that. I hope a lot of
Mm-hmm.
women would take this on board. I'm bringing back Dr. Ayeni. Welcome back, Dr. Ayeni, briefly. Dr. Ayeni, are you still back with us? Because I just saw him a few minutes ago.
Yes, I'm back.
Okay. Now, Dr. Ayeni, like I said before, how do you educate people who attribute alternative medicine to being a cake?
Well, alternative medicine to the treatment of AD is very, very much guaranteed, because if you look at the alternative medicine, you are
Right.
talking about traditional medicine.
Right.
And the fact remains is that there are a lot of men outside there
Right.
that they have tried all possible means of orthodox drugs to enhance their sexual performance, and it doesn't work.
Right.
And when they try the traditional medicine, it works.
Yes.
Traditional medicine has been in existence even before the orthodox practice.
Yes.
And that is
Can we
why
have
our
your camera
forefathers.
on, please? Because people want to know who is speaking. Can we have your camera on?
Um, Johan,
Okay,
are
maybe
you hearing me now?
it's not on. Anyway, maybe
Are
once
you hearing?
you're speaking. No, it's not. Okay, now
Are you hearing me?
we can hear you. Yes, we can hear you.
Okay. So what I'm saying is that in the olden days, our forefathers, what they use when they have a sexual problem is traditional medicine. And our forefathers in the olden days, they have many wives. Some have about 3 or 4 or even 5 wives, and they perform their sexual responsibility. The problem is that I want to talk about diet. Diet contributes a lot to our sexual problems among men, even globally. Because most of the food that we consume these days, they are not organic foods.
Right.
And that is the reason why you see a lot of people, especially a lot of men, I would say, having problem of diabetes and high blood pressure. And we have a lot of patients that do come to our office that they have high blood pressure and they are diabetic. And the fact is that the drugs they use actually affect their libido.
Right.
And if you ask them the kind of food that they consume on a daily basis, you see that most of the food they consume, they are chemical foods. But in the olden days, our forefathers, the type of food they eat is very, very organic. The kind of food they consume is totally different from the kind of food that we consume. And I want to tell the general public is that most of the diseases and the sickness that is affecting even not only men,
right,
it could be traced to the kind of food that we consume, because today we don't eat the right type of food. Most of the food that we eat, they are chemical foods, and these are the things that result into a lot of sicknesses in our body.
Right.
And that is the reason why the traditional medicine, when you come to our clinic for treatment, we first of all give you a detoxification therapy. We give you another product that can detoxify most of the toxins in the body system.
Right.
And besides that, sexually transmitted diseases, STD, is another factor that there are a lot of men that they have a long-standing STD in their body that is not treated very well, and this could lead to the ED.
Right.
But besides that, let me talk traditionally. You see, there are a lot of indigenous African herbs that can be combined together, that can give you and restore your libido back as a man.
Right.
Despite for the fact that you don't have high blood pressure, you don't have diabetes. Even there are some men, they have both together, they are diabetic and they have high blood pressure. And besides that, they take some other medications that give them, erectile, stimulant that can give, that can allow them to perform their sexual life. Because as a man, sex is very, very important in one's life. Now we have talked about the prostate. As a man, if your sexual life is very good, your chances of developing prostate cancer is very slim. And that is why we normally advise men that at least in a week, either 2 or 3 times, you must have a sex with your wife.
Right.
Because constant sex reduces chances of a man of having a prostate enlargement or prostate cancer.
Right.
And we need to go back to our roots. Even most of the orthodox drugs for sexual enhancement in terms of Cialis, Viagra, and the rest, you see, because it's a chemical drug, it has a lot of side effects. Some even affect your blood, some even affect your kidney or the liver.
Yeah.
I'm not saying that medicine has no side effects at all. But what Dr. Quincy said, that for anybody is a, it's a statement I totally disagree. Because in Nigeria today, for any other product to go to the chemist for sales, or maybe you want to sell your product to the public, the product must have been certified by the NAFDAC. And the NAFDAC must have certified the product that the product is has no toxic and is safe for human consumption. The product can be either in capsules, it can be in liquid, and the rest like that. And the dosage, the herbs, the content of the herbs must be analyzed scientifically to show that the kind of herbs you're mixing has no dose, or maybe people that's in the village that they still practice the traditional medicine in the local way.
Right.
But for any, like in Yemkem International now, most of our products most of them are in capsules, some are in liquid, and the rest like that. But we use purely indigenous African herbs that is very, very effective in the treatment and the management of erectile dysfunction.
Right. Thank you so much for that. How different are these African herbs to the Chinese ones that people like myself living in the UK, we go for Chinese herbs, and those from South America? How different are they?
Thank you very much. You see, the reason why most of the people, not only Nigerians, the reason why most of the people patronize the Chinese herbal medicine is because of the packaging and the cost of the standardization. But when it comes to the efficacy, features are more potent than the Chinese herbs. Because the Professor Labo says an African disease in African men, but erectile dysfunction is not only limited to the Africans men. Erectile dysfunction is a problem that is a global issue among all the men all over the world. But having said that, traditionally in Africa, I think African medicine is far more better. Most of the herbs in China is not available in Nigeria here. There are some herbs in Africa here that is not available in China. But having said that, a Chinese man will prefer to use a Chinese traditional medicine, while an African man will prefer to use an African traditional medicine, because our culture is different. Even our chemistry body is different. You understand? There are some medications. If in China now, a Chinese can use 1 or 2 capsules of the Chinese medicine, it will work in his body. But in Africa, an African man can use a Chinese herbal medicine of 2 capsules and it won't work. You understand? Likewise, in Africa here, and I've used to go to China. I have a lot of Chinese friends. I do attend their international trade fair for exhibition of African indigenous herbal products. I've seen a Chinese that I give my product to, the one that they normally use in Nigeria of 2 capsules that you see the effect in your body. A Chinese will use only 1 capsule and we see the effect. You understand? You can see that the body chemistry is different. But I think the reason why a lot of people prefer to go to the Chinese Chinese traditional medicine practitioner is because of the packaging, and maybe because of the colonial mentality of our people towards our own medications. Especially in Nigeria here, a Nigerian man will prefer to go to a Chinese herbalist than Nigerian herbal practitioners, because we believe that Chinese, because it's a Chinese. But forgetting that our own medicine, African medicine, is far more better than the Chinese medicine. The mentality, the religious mentality of our people towards our own African medicine is still in their brain. Because someone will say, I'm a Christian, and because it may be like lack of sensing, which is totally out of the point now. You understand? We have seen a lot of foreigners coming to Nigeria to seek for herbal solution of their cases, and they get well. You understand? But today, I think in Nigeria now, if not 60, if not 70, 60% of the herbal medicine practitioners, they have dosage, because most of their products, they're in capsules, some are in liquid, and it's well packaged. The standard is there. Because if your product wants to go to chemists and you want to sell the product to the public, that product must be certified by NAFDAC government agency. You understand? But I think it's a good development for the practice of traditional medicine in Nigeria here. But I want to tell the general public that as an African man, what you need is an African medicine. Like when you mentioned, like what Dr. Quincy said about Quincy, Yumbi, and the rest like that. We don't have it in Nigeria because there's no ginseng in Nigeria. But we have African indigenous ginseng, which is quite different from the Chinese ginseng or the HR ginseng, which is very more potent here. Because that is what our forefathers have been using. When my father was alive, my father was very old and he married a very young girl and he still performed sexually. You understand? That even the young wives still complain.
Yeah.
And that they have a lot of wives and they have children. You understand?
Yeah.
Because they have this native intellectual knowledge of the native indigenous herbal plant that they can put together that can give a solution to that erectile dysfunction.
Right.
And that is why most of the men in the olden days, they don't have this. Number one, the food they consume. The food they eat in the olden days is very, very organic, very nutritious. It's not chemicalized food we buy in the market these days. The environment they live is an added value to their health. You understand? Then they go on natural things.
Yeah.
In the olden days, when they wake up, they take a lot of herbal medicine that gives them the energy. They take herbal formulations that allow them to go to toilet regularly. There are some men, I have a lot of patients that they will come to my clinic and they will say that for 3-4 days, they don't go to toilet, they don't go to restroom. Why should a woman being stay for 3-4 days without going to toilet? It's a problem. You understand? So these are the things that contribute to the adverse of the health challenges. So at times, when you look at the problem associated to the ED, it's very complex and very, very psychological, like what they have said, the professors and the medical doctors. And coming back to the traditional way of treating ED, you see, I will say, even globally, a lot of men will prefer to use herbal remedy for the solution of the erectile dysfunction. For the fact that the side effect is very less. All medicine, herbal traditional medicine or orthodox medicine has its own side effects. Even when you abuse herbal medicine, it has a lot of, even the food that you eat in the house, if you eat it too much, it can give you an adverse effect. But herbal remedy to erectile dysfunction has a lot of benefits than the effect because it is not toxic.
Can I ask for the success rate of the herbs that you have for ED? What's the success rate?
Today in my company called GMChem, we have a herbal product called Rio capsules and Tatanic-2. These are capsulated herbal remedies for erectile dysfunction, and I've been giving it out to, people have been buying it for close over 20 years, and the success is 75% to 80%. There are some that when they take it, they will say they are not seeing much effect, but we normally refer them for a diagnostic test, because there are some men that they have high level sugar in the blood, they don't know. Some are diabetic, they don't even know until you refer them to laboratory for a medical checkup. By the time they go there, then the report will show that they have diabetes. And if you have too much of sugar in the blood, there is no amount of medication you can use. It can't work unless that sugar level in the blood is normalized. So at times when people complain of that, we normally refer them to test. But there's some people that they don't have high blood pressure, they don't have diabetics, but suddenly their sexual performance just declined. And when you look at their medical history, they are very healthy, they are very okay, but it just declines, like what the medical doctors and the professors said earlier, that testosterone might be one of the major problems. But I don't want to go on the medical side. I want to talk on the traditional level. When we look at your medical history, when we look at your medical history, that you don't have high blood pressure, you don't have diabetes, then what could be the cause? So at times you just say, okay, go and take this herbal medicine, and that is why when they take it, it restores their libido back. You understand? But the more you grow older, the lower your testosterone. That is why our forefathers, they are very, very highly intelligent. When they are getting older, they have herbal concoction, they have herbal remedy that they normally prepared that give them the sexual urge, no matter their age. It gives them the sexual urge that when they see a woman, they have that erection. And even not only the erection, they produce sperms, because it's another thing for you to have an erection
Yes.
It's another thing for you to have a production of the sperm.
Correct.
And you understand me now? That is why you see that in the olden days, our forefathers, regardless of the number of the wives they have in their house, they still perform and they still have children.
Yes.
And here today, you see a man with just only one wife, having, very difficult even to have sex once in a week. You understand? There are a lot of factors associated with it, but nevertheless, I think we need to look at what we eat, because what we eat determines the status of our health.
Oh yes.
And globally now, what we eat is one of the major problems associated to our health, and which we have to look very inward to it. Because most of the fertilizers they use in the growth of all these foods, they are chemical fertilizers. They are not natural fertilizers. And these are the food that we buy on daily basis. And that is why you see diabetes. Before, we see diabetes as a disease of older people. But now you see someone, you see human being of the age of 20, 25 having diabetes. Why? It's because of what we eat.
Dr. Ayeni, I think it's actually a given that, like most things, lifestyle changes, you cut down on smoking. I think Professor Frank said that earlier. And to do with, you check your, blood sugar levels, more exercises. Do you agree with that, Dr. Frank?
Yes, I agree very well, because
we watch what we eat, less of carbohydrates, I guess, Professor Frank.
You see, I agree. But what I said, let me conclude that. Yes, let me conclude. You see, in the olden days, like my father now, when my father was alive, my father eat only pounded yam both morning, night. Yes. But they do a lot of exercise. That's number one. Number two, they take a lot of herbal medicine that can boost the immune system to fight any kind of disease in your body. The cure to any ailment, to any disease, is in our body, and that is immunity. Yes. And that is the reason why that in the olden days, they constantly use herbal medicine that can flush out any kind of toxins in the body system. They use a lot of herbal medicine that builds the immune system, that can attack any kind of disease in the body system, which we don't have now. Okay. You understand?
Yes.
And because of
your contribution, Dr. Ayeni, I think during your submission, you actually mentioned something. I think you mentioned something during your submission there. You mentioned the fact that maybe the reason why some people do not go for traditional medicine is because of the packaging. Maybe now that you are the president of the Association of Traditional Practitioners, maybe this is what you need to bring into it, so that you have attractive packaging, you have the product information on all the products, the packaging that you have, and then to educate people, mindset, I want to things.
Thank you very much.
Let me leave it there for now. I want to bring in quickly Dr. Bolanle Odulate. If Dr. Bolanle is still here with us, she's actually a counselor. I just want to find out how she's able to counsel people. Are you there, Dr. Bolanle Odulate? If you're there.
Yes, good evening, everybody.
Good evening. Dr. Bolanle Odulate, she's the Chief Executive Officer of Brookside Center, US-trained counselor who recently relocated to Nigeria. Now, you've heard everything that we've been talking about. You were with us when we talked about menopause. Now, do you get men coming to you for counseling? How would you be able to handle it? You know the kind of mindset people have, and then you're trying to tell them about ED.
Well, it's kind of easier, and sometimes for the men that are really lucky to come for counseling before seeking other kind of help, they can find out that sometimes the psychological effect of it, like we have said, even similarly to the menopause, where they have all these irritability, depression, anger. With men, there's a little bit more of anger than you'll see with women. So if they're able to really understand it, like Dr. Quincy said that, sometimes with the spouses, they should be more considerate, but that goes both ways, because women also suffer those kind of things and men are not really there to support them. Or when they feel like a woman has fertility issues, they have the option of picking another wife. So those kind of things put stress. And then for men, knowing that the ego really stems from, oh, my performance, my sexual performance, and then to lose that, they begin to really act out in different forms. So sometimes when they come in for couple counseling, we find out that, okay, all of this fights and destructions going on in the house is actually due to the anger of the man not performing, and they're not sure of why he's not doing that. So you have to talk to them and let them realize again, like you would talk to a woman, that this is part of aging, this is part of life, there's help for this. As they're seeking the counseling and the psychological part of it, they should also seek the medical one. But sometimes, unfortunately, for some men, before they realize that they're going through a process of aging, they will have gone to the physicians or the doctors, and they will have placed them on antidepressant, which also has a side effect of, sexual, that it has a side effect. So sometimes they'll have gone through that process before realizing that, okay, this is what they're going through, and then they can get them off of the antidepressant and then come to counseling and then do CBT. It's all about the mind, try to make them positive. Sometimes even the positivity and the encouragement can even help that, because of course the testosterone is low, so we know there's a biological factor to that. And we know low testosterone really affects the mood as well. It affects mood, aggression, anger, and those kind of things come out there. So we counsel and try to let them see it and change their behavior, change their thought process, to let them see that this is a process, and if you take it positively, you can have a better effect and have a better outcome from that. So it's really helpful for them to come, but it takes a while to get to that bottom part of it. Most of the time, it's either if you see them as a couple, it's either when the wife goes out and then you're doing one-on-one with the man, and then certain things will come out. And then me being a female, sometimes it's harder for them to speak about it, but eventually they do. And when they do, they can start getting better and feeling better about the process.
All right. Thank you so much for that contribution. I just want to quickly take a comment from Dr. Adeoye. Dr. Adeoye, can you quickly unmute yourself? So I'm quickly just going to take some questions because I think we have extended time by about 20 minutes or so. Can I take your comment briefly, Dr. Adeoye?
All right, good evening, everyone. Thank you to all the panelists for your wonderful contributions and for your eye-opening discussions. I'm Dr. Segun Adoye. I work with West African Health Organization. I'm a medical doctor. But I just want everyone to know that I think there's no dispute in the effect of herbal medicine or how efficient they can be. Right. But what I want to urge everyone doing this thing, governments too are now beginning to create opportunities for herbal medicine. Even in the Ministry of Health in Nigeria, there's a department of herbal medicine. I think we need to now start keying into this initiative to standardize our activities, to create evidence-based approach to documenting our findings. You cannot just say something cures something and something cures something. It has to be documented and it has to be reviewed, by learned people that will say, oh, this thing is actually used for what it claims it is used for. And that is the only way we can have the necessary validation we are all looking for. Nobody is saying herbal medicine does not work. I love the passion from Dr. Yemkem, but what we are saying is that let us document it well. Unless if we want to deceive ourselves, we should also know that there are some dangerous herbal medicine out there. As we have successful ones, we also have dangerous ones. That is only my contribution. I also want to thank all of you for always the passion that you put into what you know how to do best. It's the only reason why you are being heard, and it's the only reason why the world is looking at what you're doing. But please let us do it right. Thank you very much.
Thank you so much for that wonderful contribution. Thank you, Dr. Adeoye. Can I just quickly ask Dr. Abolarinwa this question, because I'm quickly looking into the chat box here, and I have a question here. Can someone with erectile dysfunction still produce sperm? Yes or no?
Can you hear me?
Yes, okay. I can hear you.
Someone with erectile production of sperm actually is not necessarily a function of erection and ejaculation. You could get sperm cells directly from the epididymis and the testes. Right. So you really don't need erection to produce sperm. If you are trying to retrieve sperm, particularly maybe for assisted reproductive techniques, you can take it directly from the testes by percutaneous aspiration, you know, so you don't need an erection to retrieve sperm directly from seminal fluid. No.
Okay, thank you very much.
So the alternative.
Okay. Professor Frank, can too much sex over many years cause ED?
No.
Okay, thank you very much for that. Another question, what can actually deplete the testosterone level? It's very tongue twisting, forgive me, so fast in a man?
Well, I mean, lots of things can affect the testosterone level. I mean, going back
so
to what's
fast, at an alarming rate.
well, I'm not sure that unless you go onto a drug for prostate cancer. I mean, otherwise your testosterone doesn't just suddenly decline like that, which, you know, it's not the same as in a woman. So there are things that can cause fluctuations, such as, you know, being overweight, such as being you know, having a poor diet, lack of exercise, which is why we always repeat the testosterone 2 or 3 times before we say yes, as my GP colleague said, before we say it's low. But in terms of a precipitous fall in testosterone, I mean, that doesn't happen unless you remove the testicles, or you're on a drug for prostate cancer.
Okay, fantastic. Let me quickly run some myths or reality statements here. So I'll be bouncing around Professor Frank, Dr. Abolariwa, Dr. Aji, and then if anything to do with herbal, please jump in on that. Professor Frank, too much sexual activity cause ED? Yes or no? No. Okay.
It doesn't. And in fact, one of the interesting things that our herbalist friend said, which actually there is lots of truth in, is the fact that, you know, he mentioned having sex 2 or 3 times a week to ejaculate. There is recent evidence that actually that does reduce your risk of prostate cancer. It may not reduce your risk of the prostate enlarging, but it does look as if the more you ejaculate, the less your risk of prostate cancer.
Okay, good. Another one is the hormone therapy. It actually causes prostate cancer. Is that true or not?
No. It doesn't cause prostate cancer. But if you do have prostate cancer that's not been detected previously, then it can cause it to grow. But it doesn't actually cause prostate cancer.
Okay. Now, Dr. Abolariwa, lack of sex causes ED. Yes or no?
No.
No. Okay. Andropause is the same as menopause in women. Dr. Abolariwa?
No.
No. Okay. Taking Cialis, Viagra without having sex within the hour can cause headache.
It can. It can. Cialis particularly.
Yeah, I remember a friend actually shared that story with me, and you don't want to. I'm not a counselor, but what I advised him wasn't great. I actually told him to go to King's Cross. King's Cross is a red light district area. Why he had to take it without taking, because I noticed that a lot of African men actually self-medicate. Why they do it, I wouldn't know.
You could use Cialis. You could use Cialis for lower urinary tract symptoms. For prostate enlargement, it works for some people. For lower urinary tract symptoms, relief of urinary symptoms.
All right.
Cialis at low dose. So some people use it.
Yeah.
And it works well for them.
It's true.
So testosterone deficiency is a serious condition. Yes or no? Dr. Aji?
Yes, it is.
It is a serious okay, yes,
you know.
That's it. So the deficiency can make you less of a man. Dr. Aji?
Yes, it can.
Okay. The deficiency means that your reproductive life is over, kaput.
No.
Okay, we need to let people know, because some people, once, you know, they cannot perform anymore, you know, they go into this depressive mode and whatever. So, yeah, okay. Does Viagra help TDS, Professor Frank?
TDS, I mean, is that testosterone deficiency?
Yeah, deficiency.
No, I mean, it doesn't do anything to the actual testosterone levels.
Right.
It can help actually stimulate an erection, but doesn't affect the testosterone.
Okay. The TRT can lead to prostate cancer. Is that true?
TRT?
That's testosterone replacement therapy. No, it doesn't. But as Paul has said, if there's prostate cancer on board, without detection, then testosterone therapy will worsen it.
That's right.
Okay. Now, a question for the traditional practitioners here. Healthy lifestyle will not help men living with TDC syndrome. Dr. Ayeni, yes or no? Oh, has he gone? Okay, Dr. Quincy, you take that. Healthy lifestyle will not help men living with TDC syndrome.
It will help them.
Okay, good.
Mhm.
ED is hereditary. Professor Frank?
Mm.
No, it's not. Okay. ED is reversible. Maybe with your herbs. Dr. Quincy, is that true?
Oh, yes, yes.
Professor
It
Frank?
is.
It
It
is.
is.
Medicine.
It is, yeah.
It is
It
true.
is. Depending on the cause,
It's
of
true.
course.
Okay, good. All right. Men also have similar symptoms with women going through the menopause, because I think somebody was actually sharing with us that some men have hot flushes. I've never ever seen any man fanning himself. Dr.
You know what?
Adenaike.
They exist.
It's
They
rare.
exist.
It's rare.
I've
Really?
never
It's
seen
rare,
one.
but they do.
It can
They
Really?
happen.
do.
I've
I've
It's
never
seen some.
rare.
seen. Okay.
I've never
Um,
seen it.
okay.
It is rare.
It is
rare.
rare. Okay. Dr. Aji, you are a
Yeah.
golfer. You are always in the midst of all these golfers. Have you ever seen any man fanning himself? Even maybe,
Things having what
without
flashes.
using his club.
No, but no, the process of dealing with hot flushes is kind of different.
Okay.
Lifestyle, dressing, and all. But
Mm.
hot flushes associated with andropause or decreased testosterone, the
Yeah.
manifestation is subtle and it's rare.
Okay.
So that's why it's not so common. You see someone finding themselves and things
Okay.
like that.
All right.
But it's a rare manifestation, but it can happen.
Okay. Dr. Ayeni, I'm not sure whether he's there. Men over 50 will experience ED. Is he there? I'm not even sure. Maybe he's dropped off again. Dr. Quincy, do you want to take that? Men over 50 will experience ED.
They could.
Cold. What about you,
Yes.
Professor Frank? Men over
Well,
50 will experience ED. All
I
men.
don't think it's a question of age. There'll be a percentage of men, and we have men in their 20s who've got ED. So it's not the age per se.
Okay.
But as you get older, you're more likely to have hypertension, kidney problems, diabetes, and so on. So it's not the age; it's more the comorbidities, the other illnesses that you have.
Okay. Dr. Adenaike, I'm not sure whether she's still there. ED is caused by too much sitting down. I'm not sure whether she's dropped off. Dr. Abolariwa, ED is caused by too much of sitting down. Is that true or not? No. Okay.
False.
Right. Dr. Aji, diabetes, high blood pressure, and heart disease, they are major causes of ED.
Yes.
There. Okay. Dr. Quincy, symptoms of ED will disappear within 5 years.
Within 5 years,
Yeah.
it depends on the level.
Of
It should disappear if you are managing with herbal medicine, with licensed, recognized, registered, standardized, evidence-based herbal medicine. Yeah, it could disappear before 5 years.
Okay.
Less than 5 years.
Okay, Professor Frank, what's your take on that? Symptoms of ED will disappear within 5 years.
It really depends on what the cause of the erectile dysfunction is.
Right.
So, for example, if you've had, as was alluded to earlier, a radical prostatectomy where your prostate gland has been removed for prostate cancer and the nerves have gone, then it's not going to come back in the next 20 or 30 or 40 years, you see.
Right. Okay.
If your erectile dysfunction is because you've lost your job or you've got some sort of issue in that respect, you get a new job, you can get more money, then it'll come back.
Okay.
So it depends on the cause of the problem.
Okay, stay there, Professor Frank. I have a statement here. I noticed some years back when I had sex without ejaculating, lusted to have pains in the testes. High goes off after a while. I don't know what that means. I don't know if that was a precursor to the ED I'm experiencing. I'm currently 59. Do you understand that statement?
know that
I
So
noticed
he,
some
estrogen.
years back when I had sex without ejaculating, lost to have pains in the testes, high goes off after a while. Or does the person want to actually ask the
I
question
think,
or make the statement? I'm not sure whether the
yeah,
person want to do that. And
I'm,
he's 59. He doesn't know whether it was a precursor to the ED.
I
He's
don't think
assuming.
so. I don't think so.
Okay.
I think it's unrelated.
Okay, all right. Otumba wants to ask a question. I think that's the final question we're going to take. Otumba wants to ask a question. I don't know his last name. Otumba, it says Oseni, I think. Is he still there? Otumba Oseni,
Yes,
just quickly.
yeah,
Thank you so much for joining us.
yeah. Thank you very much for having me. Well, most of the presentation have already addressed my worries,
Okay.
and I just also want to quickly ask this, even though it's maybe repetition, but I want to get it clear. A
Yeah.
risk of taking Viagra
Yeah.
when one is already in the ED mode.
Yeah.
What are the side effects? Could that lead to a problem of seizure and all that kind of thing?
A problem of what? Oh,
Seizure. Can you have heart attack?
yeah.
You know,
No,
when you,
no, no, no. So, the thing about Viagra is that, generally speaking, it is a very safe drug. And in fact, now in the UK, you can get it over the counter. There are certain reasons why you shouldn't take it. So there are certain drugs that you shouldn't mix it with. So some of the drugs that are used for heart problems, like nitrates, for example, if you take Viagra with that, then your blood pressure can fall seriously, and then you can come to harm.
okay.
Generally speaking, it's a pretty safe drug. The side effects of flushing, facial flushing, maybe indigestion, maybe some colored disturbance and visual disturbance are temporary and not dangerous.
Thank you very much. And the very last one, quick. Well, we talked about this ED thing. If someone, you say, the more sex you have, the more likely that you're not going to have prostate. So if one now is down with a problem of ED for a long period of time, is that going to lead to prostate?
Well, that's a very good question. I've not seen. I would suppose that would be the case, but I've not seen the data or the research studies to linking ED with later risk of prostate cancer. But it would seem to me to make sense. But there is no data that I've seen on that.
Thank you very much.
Thank you so much to all our guests. And I noticed, I'm not sure whether that's a hand going up there. Mrs. Taiwo Ajayi Lyset, is there a question there or a comment? Thank you so much, Ma, for joining us on this discussion. I encourage a lot of women to join so that even if the men can't come, they can listen in and then go back and tell their partners. Is there any question you'd like to ask Mrs. Taiwo Lyset? I think you're
Thank you very much. Just to thank the participants for the enlightenment they're giving. It is a little more disappointing that we don't have more Nigerian men giving light to this. This masculinity issue that we have, the head of the family, and this business where our men think that they're the givers of sex, and that the women are the recipients, which is why they get into depression when they cannot perform. When they've made themselves performing animals, they know naturally they're going to put great pressure on themselves to perform. It is not surprising that many women perhaps are not supportive when they're in that dire state, because they've posed and formed, as they say here in the lingo here, that they are the kings of the jungle. So when they're not able to strut around anymore, then they've lost it. The thing is that we should realize that this is a joint venture, and nobody is giving anybody to anybody anything. And if you're not at the beginning letting your partner know that this is something you are together in, is a journey that you're taking together, and you think you are the prime mover of all these things. It's no wonder that they can get into distress at any age, but it is age exacerbates the problem of where the ebb and flow of the testosterone. And of course, it's not flowing as you're getting older because of all manner of underlying conditions that we acquire on the journey. So maybe if younger men tuned into this, they can know that it's not really, sex is not just about the men. Men think that sex is created solely for them because they're external. Women are internal and women are deeper. And they don't know that they really do need the support of their women to get them through this. That it's not their Olympian performance that the woman likes in them. It is their soul, it is themselves that they like. So when they can't perform anymore, they think all is lost. And why should the women hang around if you have been telling them that you are the one moving it? But it's a pity, because I think men in this this sexual business, men forget that they're the people who kneel at the altar of sexuality, at the women's altar, and that they should really respect the women, not just as givers. They command them to worship them. Thank you very much for
Thank you so much
for this session. Very, very enlightening. Thank you for
so
all
much,
the technical details and knowledge that we've had.
Thank you so much, ma'am. Thank you, Mrs. Taiwo Ajayi said you have a fan in Dr. Tonya Adenaike. She was busy clapping for you. For those who do not know who she is one of Nigeria's foremost actresses, a veteran actress. Thank you so much, ma'am, for joining us and for making your contributions. Very much appreciated. You could tell that
I grew up watching her.
I think majority of us actually grew up watching her.
Yes.
I'm going to tell final thoughts. My final thought, I'll take that from Dr. Tunde Ayeni. Briefly, your final thought on this subject of erectile dysfunction.
Yeah, my.
No dear, we're losing you again. Okay, I'll move briefly to Dr. Quincy Ayodele.
My candidate is not only to.
Okay, Dr. Quincy, can you unmute? Yes, your final thought, briefly.
My final thought on this topic is that, like Auntie Lycent has said, that men should see women as we're in partnership. They should mind how they use their body when during their youth, so that they will not come and end the whole thing in their old age and then allow the women to now be carrying the wahala about. That's on one side. On the other side, like Dr. Adeoye said, we have a whole Department of Traditional Medicine in the Federal Ministry of Health in Abuja. So traditional medicine has passed the stage of saying there is no dosage. What we are saying is if you have a herb, then take it for standardization. The reason why people are patronizing Chinese traditional medicine is that they have standardized their own several years ago. That's why I could be able to mention Yohimbe, red ginseng as an example of herbs that have dosage. That doesn't mean that we don't have similar ones in Africa, but have they been registered? Have they been standardized? Is there evidence? And I practice only on evidence with evidence-based herbs. Thank you.
Thank you so much for that. Mr. Russell, final thought. Briefly.
My final thoughts.
Yes.
My final thoughts are, I am really delighted to have been a part of this discussion, and I've learned, even at this stage, after I've been through years of this particular illness, I've learned new ways dealing with it. And I wish I could sort of impart that with other. I'm definitely going to impart it with others, colleagues, family, and friends.
Mr. Russell, I can tell you that you've paved the way already for Black people to come out in the open and talk about sensitive issues like this. You have actually done that. And this is the second time you're sharing something very, very intimate with us. I thank you so much for that. And I also thank Mrs. Russell for allowing you to come on the program to share the secret with us.
Yes, not at all. She's backing me all the way, and we're working in unison together. As
Fantastic.
I heard the critique earlier, positive critique from your actress lady, and you know, it's very important that men and women who it concerns actually work together to eradicate these things and to really minimize the risks.
Thank you. Dr. Toyi Adenaike, final thought? I'll just take that from you since you spoke as well as a GP in Nigeria. Okay, she's probably not there. I'll take the final thought from you, Dr. Aji.
Thanks. And thanks for all the
Hello?
panelists. And
no,
can you
carry on,
say,
Dr.
yeah,
Aji.
I'm on. Yeah, thanks to all the panelists. I mean, as we say, andropause is not the same as menopause. Any age, men can have reduced testosterone. It can be caused by various factors, and AD also can be caused by various factors. We should not shy away from it. Go to your doctors. Blacks, please speak up. Go to your doctors, discuss these issues, because there are treatment, various treatment. It's not only about testosterone. It might point towards something much more sinister and much more dangerous. So when you speak up, that's when you can be helped.
Thank you
you
very
for
much.
organizing this.
Thank you. Dr. Toyi Adenaike, final thought?
Yes, I want to thank you for organizing this and for bringing this to the forefront. We need to encourage our men to come forward and speak up. So I'm saying the same thing that my GP colleague said. And we must remember that ED and andropause and some of these other male issues are symptoms of other problems. So we must remember that it's not just ED, it's associated with so many other things, and only the right people, the right doctor, including our traditional practitioners, can help men to overcome this. But bravo to Mrs. Ajayi Lycett for reminding us that this is about couples, and we must remember that we're in this together, and our men to value us and know that we're part of the journey with them. Thank you.
Thank you very much. Dr. Bolale Odulate, final thought, quickly. I don't think she's there. Okay. Final thought?
Okay, I think Auntie Taiwo has said everything for us from the psychological part of it. And what she said is really the problem, because when the men see themselves that way, they begin to have performance anxiety and all of that. So I think she's done the final thought for me, because I share exactly what she has said. Thank you, Ma, for that. We thank you from the psychological parts of what you have said.
Thank you. Final thought from Dr. Ayeni.
Yeah, thank you. My candid advice to the couples. Erectile dysfunction is not a problem of only the man. I think it's a problem of the couples, the wife and the husband. And I want to advise all our women at home that they should be more romantic, and they should be very more friendly to their husband, because if a woman is very romantic, automatically it's another therapy to the solution of erectile dysfunction. And they should not forget that herbal medicine is very, very effective and very, very more potent. The idea of no dosage, no measurement, no standardization has been totally put off from the practice of the herbal medicine in Nigeria. In terms of documentation, if the Chinese can have their medicine in all over the world, I see no reason why the herbal medicine in Nigeria should not be available in all parts of the world. I think we need this government support in this direction. But as far as erectile dysfunction, I still saying it, that herbal medicine has a lot of role to play in the treatment of erectile dysfunction. But the fact remains that the wife should see the problem of erectile dysfunction in her husband than the husband. And that is the only way they can get the solution out of the problem.
Right. Thank you so much for that. Briefly, Dr. Abolariwa, final thought.
Okay, thank you very much for organizing this lecture. Thank you, Dr. Adioye, for that comment. He's my classmate from Med School Ibadan.
Wow.
I also want to state that erectile dysfunction is a multidisciplinary issue. It can be approached physically, medically, and even psychologically too, socially. We need to disabuse the prominence and the focus of the importance or maybe the power of sexual intercourse on the man in Nigeria, particularly culturally. They make so much noise about it that any little problem a man has with the erection is seen as if he has lost his value and his relevance as a man. We need to start disabusing that a man has bigger roles beyond sexual intercourse. And then we also need to let them know that once that starts, there's a solution. It depends on how far you want to take it. Do you want to get all the way to surgery? There's a solution. So they should come to the hospital already with the ideology that there's going to be a solution. And I think that's my comment.
Thank you so much for that. And last but not the least, Professor Frank Chinegwundo, your final thought.
Yes, thank you very much for this opportunity to participate in this wonderful webinar. I just wanted to mention one thing that has not come out earlier. Young men with erectile dysfunction, I did talk about smoking, but also recreational drugs are a big problem. So I'm talking about cannabis, I'm talking about heroin, I'm talking about ketamine. So one of the things to ask, especially the younger man, is whether they are taking these recreational drugs.
All right. Thank you so much for that. I'd like to say a very, very big thank you to everybody